thing becomes a much more focused question. And it really, in a sense, it sort of flips the focus to something like pertussis, where we know that because pertussis vaccines, they're certainly worthwhile and they're good at protecting young children against severe pertussis, but we also know that they're not that great against mild pertussis, getting a bit of a cough, and they do wear off. And so even with 100% of kids getting immunised about pertussis unfortunately still circulates in the community, unlike measles. And until we get a pertussis vaccine that's up there with measles with a 95% effectiveness or something, we're going to continue to see that. The pertussis will continue to circulate, even though it's got high immunisation rates. And so the solution to that is maternal immunisation, which is the way of bridging that gap, the gap between a child being born and having had its first one or two vaccines, after which the protection against severe disease is pretty good. But there's that gap of 2 or 3 months before that's happened, where the only way to protect those really young babies, who are the ones that, of course, get sick and the ones that die, the only way to protect them is for the mothers to be receiving vaccine and pregnancy. And so I think if we're really keen on preventing the cases of severe disease, if that's our primary aim, then it makes much more sense to be going hard on promoting, supporting maternal immunisation as much as we can, both at the general practice level and in hospitals and other places. And that's the way to protect the really little babies, the babies who virtually never be attending a childcare centre and certainly not a preschool. If you want to protect them, then that's our approach. That's what we need to be emphasising. I mean, the main concern was, and hopefully this is not the case among the medical audience, but there's still this view out there in sort of general public land or, the pub test or whatever, firstly, that we've actually got much lower immunisation rates than we do, and they're actually very high, and they've been high for a long time. And secondly, that there's lots more conscientious objectors than there are, and they're going up all the time, which they're not. And thirdly, that unimmunised children in a childcare centre or a preschool pose a huge risk to fully immunised children, which unless you've got a fully immunised child who happens to have some bad disease like leukemia or something, in which case they're probably very unlikely to be attending a regular preschool. But unless you've got children like that, then basically everyone else, they're really not at risk. They're at risk of all kinds of other infections that circulate in childcare, including, influenza, obviously. Another one we'd like to see, the influenza vaccine rates, improve, but they're not going to be getting measles. They're not going to be getting meningitis from Hib or.
Thank you so much for your time.
Thanks, Kate.